Hey guys, it's Jessie from the Dental Wellness Center in Maryville, and today I wanted to talk to you guys a little bit about dental implants. So what most people don't know is that at least 69% of people ages 35 to 44 are actually suffering from missing at least one, if not multiple, permanent teeth. Now most people think, hey, it's not a big deal as long as it's not a front tooth, nobody can see it, no harm, no foul. Unfortunately, that's not actually the case. What most people don't realize is that even missing one tooth can lead to multiple issues with your mouth. You can suffer from speech problems. You get to miss out on eating all the delicious foods that you used to love before. Besides for that, missing even one tooth can actually lead to significant bone loss throughout the years. You may not really notice it at first, but then you'll start to notice that your teeth will begin to shift and it'll actually change your jaw structure and your face shape. So implants are an awesome alternative to just missing the tooth. A couple questions that I normally get asked whenever I'm talking to someone about implants, they always want to know, does it hurt? Most of the time, no. If it does, then you need to get the implant checked out after it's placed. The worst part about getting an implant is getting the tooth taken out. Once it's taken out, you've done the hard part already. After that, honestly, it's pretty easy breezy. The procedure itself, depending on what you're getting, usually you're in the chair for about an hour, hour and a half tops. Next day, over-the-counter pain meds usually take care of any of your issues. There's a little bit of pressure tenderness, but nothing that, like I said, the over-the-counter pain meds can't take care of for you. People want to know how long the process takes from start to finish. Best case scenario, usually about 3 to 4 months. Once we place the implant, we bring you back in a week just to make sure everything's still looking good. From that point on, we usually have you come back in about 3 months. At that point, we will scan you up and get the process started to make your permanent restoration. That usually comes in about 2 weeks. And as long as that looks good, then you're all fixed up. You just need to continue with your 6-month recare like you would a normal tooth. There's no additional procedures that need to be done, any extra costs as far as cleaning goes if it's just replacing a single tooth or even a couple teeth. You still want to brush around the area, you still want to floss or use a water pick. Besides for that, people want to know, why can't I just get a bridge? Why can't I just get a partial? Why can't I just leave the space alone? Well, you definitely don't want to leave the space alone just for the reasons that I listed earlier. As far as the bridge goes, bridges are great. The only downside to them is that unfortunately you have to take perfectly good teeth on either side of that missing space and cut them down. So you're turning a 1-tooth problem into a 3-tooth problem, if not more. Some of the other questions patients ask is, how successful is the implant? If I get it placed, what's going to happen? Well, it's just like anything else in life. There's no 100% guarantees. Statistics do show, though, that there is a 95 to 98% success rate. So honestly, they do just as well as any other procedures do, if not better. And the outcome is a lot more gratifying than some of the other procedures. People want to know if they're going to be without a tooth the whole time that this area is healing up. It kind of depends on the patients. If it's a front one, we have options that we can discuss as far as something to occupy that space while you are healing. But again, that's specific to each person, so that would be something you would need to discuss with your doctor. Obviously, the big question that I get asked, even though it's not really my place to answer, is it affordable? Will my insurance cover it? Everybody's insurance is different, just like everybody's mouth is different. That would be something you would need to discuss with the financial coordinator, but they are really excellent about talking to you about what your insurance will and will not cover. and they'll even talk to you about some lending companies that can help make it more affordable, get it down to a monthly payment, so that way you can achieve the amount that you want without breaking the bank. Any other questions? Feel free to comment below. Otherwise, thanks so much, guys. Have a great day.